それでは、次に、このワールドヘルスサミット、世界医学サミット、リージョナルミーティング、京都会合2015を振り返ってですね、2日間の短い会合でございましたが、福島県立医科大学理事長付特命教授、インディアナ大学教授のトーマス・イヌイ先生に、この振り返っていただきたいと思います。どうぞ。Your headphone take off. Okay.
I should be honest, I had forgotten that I was to offer comments at the close of the meeting. Shunichi knows that I'm a sponge for impressions when I go to meetings, that I spend a good deal more time taking in ideas than you would at first know from my activity in front of microphones. So he assigned me this role some time ago and I accepted. Here then are the impressions that I'm carrying with me at near the close of this meeting. First, it's very refreshing to have such a diverse group of individuals come together in a setting to discuss health development, healthcare systems change, and the needs of these systems to be resilient and responsive in the face of major challenges. That set of considerations, resilience and responsiveness, was engineered into our proceedings. Had we not done that, we would have needed to think along those lines anyhow, but not just as a group of healthcare professionals. That's what I meant by the refreshing opportunity to listen to others who are from government, from industry, from various health professions, young people, such as the high school students that I had a chance to see in one session, and then, since real conversations often take place in the bathroom, I talked to several of the young men in the bathroom about their impressions, to hear then from the large array of stakeholders in this enterprise about their views about what should be done and why what we're discussing is important today, is across the generations, is, I think, a critical opportunity and has been successful during this conference. I'm still processing the thoughts. I knew that the award winner was somebody special when late yesterday, when I was studying the posters, I heard a click and she was taking my picture with her phone and then steered me to her poster so I could understand what was there. I knew that we had a diverse audience, not only when I was chatting with the high school students, but also when I just had a conversation with a young nurse from Alberta, Canada, who is here to think about health because while nursing is her professional identity, she is thinking larger thoughts about systems. I'm going to say that the triple disaster in Fukushima was a very apt focus for our considerations, and that it raised for me several thoughts beyond responsiveness and resilience that I will finish with. I'm going away thinking that those are fundamental considerations, but there's something like a moral core and commitment which is a related but different dimension of thought as a society and as health professions that we need to reflect upon, when we answer the question not only what should we do and what should we have, but why. And then maybe this is a peculiarly North American comment, but from the US, I'm going to excuse Canada from this excess. But sustainability of the institutions of health development and healthcare, financial sustainability perhaps is a topic that we will also turn to in time. So I thank you for the opportunity to be a listener. I'm going away thoughtful. I want to learn more about Fukushima, the environs, and what's happening there. Arigatou gozaimasu.
乾先生ありがとうございました。乾先生は、おじい様が日本人で、福知山のかんざし職人だったそうです。日本の大恐慌の時に、アメリカに渡られて、大変苦労されて、息子さんをジョンズ・ホプキンスの心臓外科医に育てられ、そのお子さんがトーマス・乾先生ということになります。大変今回ご参加いただきご総括いただいてありがとうございました。